Hey guys, I'm preparing this video for menstruation pain and also constipation. First a moment, the discomfort is merely annoying. For others, menstruation cramp can be severe enough to interfere with everyday activities for a few days or in a month actually. So I have been receiving a lot of messages, and also some of the members are asking me for they really have a very bad cramp and lower back pain and also constipation. And another serious problem I have been receiving that some of my members told me that they didn't get their period for a few months, and that's really it's like, for me, it never happened before. I mean, it never happened in my entire life. There are so many factors it can cause this kind of problem, and it can be serious. So what happens during your menstruation period? Your uterus contracts to help expel its lining, and in the hormone-like substances, it called prostaglandins involved in pain, and this is cause inflammation and then trigger the uterine muscles to contract. Higher level of prostaglandin, that hormone, are associated with more severe menstrual cramps. So it's really these are very very scary things. So it can be caused by the tissues that lines your uterus and becomes implanted outside your uterus, most commonly on your fallopian tubes, ovaries, or the tissue lining your pelvis. So also another cause probably is uterine fibroids, these non-cancerous growths in the wall of the uterus can cause pain. I used to have in 2017. I started to have blood clots in my periods, and it wasn't normal. And a person like me, I really, it really bothers. So I went to hospital, and when I check it, they actually did ultrasound, and then some cameras they put inside, and they found there was a polyps. So I had to, really remove that polyps. The fibroids is more bigger, and it can be really big, like a baby. So time to time, it's good to see the doctor and check whether there is something like abnormal tissues. So it would be good. And these are like polyps and fibroids are really make different and very painful. The tissue that lines your uterus begins to grow into the muscular wall of the uterus. That is like adenomyosis. So that's another cause probably. Another reason that we get pain probably is pelvic inflammatory. We don't say disease, but maybe it can be disease. So that gives you more inflammation. This infection of the female reproductive organs is usually caused by sexually transmitted bacteria. So if the girls or ladies that who is not involved in the sexual relationship, also is very important to go and see a specialist and doctor. Another reason probably is cervical stenosis. In some women, the opening of the cervix is small enough to impede menstrual flow, and that is causing pain, increase of pressure within the uterus. So we always think this is our regular life. Every month it has to come, which is always a good thing, that we have at least exchange. All these bloods are going, that is unused blood, used blood, but it's useless blood are going out, and then same time we have to recover, we have to renew other blood cells. So risk factor will be like, you might be at risk for menstrual cramps if you're younger than 30, or sometimes it's over 30 also they get more cramps. If you started puberty early age, 11 or younger, and then you bleed heavily during periods, you have irregular menstruation, bleeding, you have a family history of menstruation cramp, so these are the risk factors. It can be very complicated. Menstrual cramps don't cause a medical complication, but they can interfere with the schoolwork and in social activities. Sometimes even like we have fitness, and then some members disappear all of a sudden, and the reason, if I ask them, then they will say, I had a period. For me, it's surprising because when I have period, I usually do more exercise to increase my blood circulation. But for some reason, some members say that they are in very, very painful situations, so they try to avoid. Also, the smoke and lifestyle, like drink. If you are, your sleep pattern is not good, your lifestyle is different, then you sleep in the daytime and you wake up in nighttime, that also cause. So trying to change the healthy lifestyle is always helpful for these kind of things. Certain conditions like associated with menstrual cramp can have complication, though. For example, endometriosis can cause fertility problem. Pelvic inflammatory disease can scar your fallopian tube. So it's not, this is not a very small scenario. This is like a big, increasing the risk of a fertilized egg implanting outside of your uterus, ectopic pregnancy. So there are so many things we have to be really aware of, and exercise is always gonna help you. So here I am lying under the sun. This is very, very good idea. Like you can just lying down on the sun if you're going to if you're in the beach, or if you're in the open area. So just get some oil and start to do good massage for yourself, or you can always see specialists or physical therapists, and please feel free to contact us for more information. Thank you.